Ever wondered what the most common cause of indigestion is? It's peptic reflux esophagitis, a rather long name for a condition that's caused by the persistent backflow of acidic gastric juice into the esophagus. This regurgitation doesn't sit well with the delicate lining of your esophagus, leading to irritation and potentially painful ulceration. Imagine the raw burn of a scraped knee but inside your chest. Not a pleasant thought, is it? But it gets worse. The constant irritation can erode the blood vessels in the esophagus, leading to hemorrhage. That's right, bleeding inside your esophagus. This is why it's so crucial to recognize the symptoms early on, like heartburn, belching, or a sour taste in your mouth. And the key to managing this condition? Early diagnosis and treatment. So if you're experiencing persistent indigestion, don't brush it off. Seek medical help. Remember, the key to managing this condition is early diagnosis and treatment. Did you know that swallowing caustic materials can cause severe damage to the esophagus? Let's delve into that. When caustic substances, those that can burn or corrode, are swallowed, they inflict burns on the walls of the esophagus. This triggers an inflammatory reaction as the body tries to heal the damage. Now, the extent of this damage isn't arbitrary. It hinges on two key factors: the concentration of the caustic material and the amount swallowed. But the story doesn't end with the healing of the initial injury. In fact, the plot thickens. When the injury is severe, the healing process can lead to fibrosis, the formation of excess fibrous connective tissue. As this tissue shrinks, there's a possibility of an esophageal stricture developing later. This is a narrowing or tightening of the esophagus that can cause swallowing difficulties. Always be careful with what you swallow. The esophagus is more delicate than you think. Next up is a condition that tends to occur in young adults. Achalasia. This condition is characterized by the constriction of the cardiac sphincter, a ring of smooth muscle fibers at the junction of the esophagus and stomach. Due to this obstruction, the passage of ingested materials into the stomach is blocked, leading to the dilation of the esophagus and hypertrophy of its muscle layer. Now, you might be wondering, what does this mean for the person affected? Well, the symptoms can be quite disruptive. They may experience dysphagia, which is a fancy term for difficulty swallowing. Additionally, they might also suffer from regurgitation of gastric contents. This is not just uncomfortable, but it also poses a risk of aspiration pneumonia, a severe lung infection that occurs when food, stomach acid, or saliva is inhaled into the lungs. Achalasia can be a tricky condition to manage, but with the right care, its impact can be minimized. Now let's talk about a serious condition, esophageal rupture. This happens when the esophagus, the tube that carries food from your mouth to your stomach, tears or bursts. This can occur usually at the distal end of the esophagus, and it's often triggered by sudden distension. Think a severe vomiting attack, ingestion of foreign bodies, or the passage of an instrument. When the esophagus ruptures, gastric contents, that's your stomach's digestive juices, can pass into the mediastinum, the central compartment of your thoracic cavity. This can cause acute inflammation, a rapid immune response in reaction to injury or illness. The symptoms can be quite severe, including sudden severe chest pain, vomiting up blood, difficulty or pain when swallowing, and shock. It's a serious condition that can lead to life-threatening complications if not treated immediately. Esophageal rupture is a medical emergency that requires immediate attention. It's important to seek medical help right away if you or someone else may be experiencing this. Finally, let's discuss the different types of tumors that can develop in the esophagus. The first type is known as a Hemorrhage or fibrous tumor. These tumors spread around the circumference and along the length of the esophagus, causing thickening of the wall and a loss of elasticity. This can lead to difficulties with swallowing and discomfort. The second type of tumor is a soft tissue tumor. Unlike fibrous tumors, these grow into the lumen or the inside space of the esophagus and spread along the wall. This growth pattern can cause blockages and further difficulties with swallowing. Both types of tumors can drastically alter the function of the esophagus, and if left undetected, can cause serious health complications. Therefore, it's essential to keep an eye on any persistent changes or discomfort in your throat or chest area. Early detection of esophageal tumors can significantly improve the prognosis. Stay vigilant and take care of your health.